Good afternoon, students. This is a video for the thoracic vertebrae. In this video, I will tell you the usual Viva question which are usually asked for the thoracic vertebrae, especially for typical how to identify or how you have identified that it is a typical thoracic vertebrae and what are the features of a typical thoracic vertebrae. The next video which I am going to record, it will be in relation to atypical thoracic vertebrae. Now, these diagrams and illustrations which I have taken, they are from the Grand Atlas of Anatomy, and I edited this atlas for South Asia edition, and this was published by the Walters Kluwer. I am thankful to the publisher Walters Kluwer. I assure you that this is a good dissector which you can use for your study of anatomy. Now, the question which an examiner will ask when you are given the thoracic vertebrae, he will ask first question, okay, how to classify the thoracic vertebrae, whether they are typical or atypical, okay, because you already know that there are 12 thoracic vertebrae and naturally out of 12 he will ask you how many are typical and how many are atypical. He may also ask that what do you mean by atypical thoracic vertebrae? Just give an answer that typical thoracic vertebrae are those vertebrae which resemble each other in their anatomical structure or features. Okay, that means if you have studied one typical thoracic vertebrae, you will know automatically the features of other typical thoracic vertebrae. And then atypical means where each and every vertebra which belongs to atypical group has its own different characteristic or morphological feature which do not resemble with other vertebrae. And then naturally the question will be there, which are the typical thoracic vertebrae? You tell him or her that the typical thoracic vertebrae are from T2 to T9. Similarly, atypical vertebrae is T1. Atypical vertebra is T1, T10, T11 and T12 because their features are different. But in this video I am going to tell you only about the features of a typical vertebra and the questions related with that of a typical thoracic vertebra. Now in these two diagrams you can see that these are the 12 thoracic vertebrae and the upper one, that is the T1 thoracic vertebrae, is atypical. Similarly the T10, T11 and this T12, they have some different feature about which we will talk in the next video. In this video I am going to talk about T2 to that of the T9, okay, thoracic vertebra. Here is the superior view, okay, of all the typical and atypical vertebra. Here from T2 right up to T9 we will learn about the different features by which we can identify a typical thoracic vertebrae. Now, since you already know about the parts of a vertebra, that is body and neural arch consists of pedicle and lamina. Okay, this is the body, this is the pedicle and this is the lamina which fuses to form a process called as a spinous process. Other process which come out from the neural arch part of the vertebra is, these are the two superior and two inferior which are not seen in this view. Then there are the two transverse process and single spinous process. So there are 7 processes coming out from the junction of pedicle and the lamina which forms the neural arch. There will be a foramina here and this foramina is vertebral foramina. With this introduction, I just go to the questions which will be put to you for the typical thoracic vertebra. Now the examiner will ask why you have said that this vertebra is a typical thoracic vertebra. You give various reasons for saying so. We begin with the body and then we will show various reasons why it is a typical vertebra. You can say when you will see the body from superior or inferior surface, as you are seeing in this diagram, the body is having the heart shape. See this? pointed anteriorly and broad posteriorly. So this is an heart-shaped body both on superior as well as on inferior surface, which is the important point for determination of a typical thoracic vertebra. Then talk about the pedicle. Pedicle are flattened from side to side. They are not rounded as we have seen in case of the cervical, or we will see in case of the lumbar vertebrae, and they are quite weak. Then you come to this lamina, and the lamina part of the typical thoracic vertebrae, you say him that they are thicker. In case of cervical they were very thin, paper thin, but here lamina are quite thick in structure. After that you come to the features which are present in the process. Then tell him that if we see the superior articular facet here, which are present on superior articular process, the facet are directed posterolaterally in the direction in which I am moving this pointer. They are directed both right and left. Similarly, when you will turn and show him the inferior surface, which is not shown in this diagram, you say that the two inferior articular facet, they are directed anteromedially, because the superior are facing posterolaterally. Naturally the inferior will directed anteromedially direction. This is another important, clue for identifying the typical cervical vertebrae. Then come to the facet here on the transverse process. Then tell him that transverse process are long, they are knobby at their end, that means they are quite thick at their end, and on the anterior surface of the tip of the transverse process there is oval facet in each transverse on right side, and that is called as the costal facet. Then the question will come, what kind of the joint is there on this facet? You say that this facet on transverse process, which is called as costal facet, will articulate with the tubercle of the rib, and this joint is called as, next question may be, what is the name of this joint between the tubercle of the rib and the tip of the transverse process? You say that it is the costotransverse articulation or joint. Costotransverse articulation is there. Then another question will be there based on the basis of what structure we see on the lateral surface of the typical thoracic bone. See, this is a typical thoracic bone or vertebra, and here you are seeing it from lateral surface. The striking feature, you tell to your examiner, I have told this vertebra as a typical thoracic because it is showing the two facets at a superior border of the body and at the inferior border of the body. The upper is the upper demifacet and lower is the lower demifacet. They are also called as costal facet, superior and inferior costal facet, because they also articulate with the head of the rib. Remember that on the transverse process the costal facet was articulating with the tubercle of the rib, but here it is articulating with the head of the rib. Naturally the upper facet is bigger, and it is very close to the superior border of the body, more extending towards the pedicle here. This is the pedicle of the vertebra, and then the inferior facet is usually very small and very close to that of the inferior vertebral notch. This is the inferior vertebral notch. So in this way you can differentiate that any typical thoracic vertebra will have the two superior costal face, superior costal facet and an inferior costal facet on right and left side, very close to the margin of the body, inferior and lower margin of the body. Then you say that here the lamina is thick, and lamina will fuse with each other right and left side to give rise a process what is called as the spinous process. And you can see in this vertebra, the spinous process is very long and it is directed downward and pointed at the tip. Okay, these are the longest spinous process in the whole vertebral column, which are with that of the thoracic. So I have given so many points by which you can say that this is a typical thoracic vertebra. In nutshell, you again tell to your examiner that on the lateral surface of the body there are superior and inferior costal facet, which is characteristic of typical thoracic vertebra. Then there is a facet on the tip of the transverse process on its anterior surface, and both these are for articulation with the rib, costovertebral articulation and costotransverse articulation. The superior articular facets are directed posterolaterally and the spine is directed downward and quite long and the vertebral foramina is rounded and small, okay, because the pedicles are directed posteriorly. Okay, in thorax and cervical they were directed laterally. That's why the vertebral foramina was triangular in shape. I think that I have covered all the questions which can be asked on a typical thoracic vertebra. Okay, you just revise with the help of your textbook and then you will not forget this Viva based on the typical thoracic vertebra. Thank you very much for watching this video. The next video will tell the atypical thoracic vertebra characteristic feature which are usually asked.